Levi is the joy of our life, as most children are. He is a miracle child. He is incredibly intelligent. Came out of the womb wanting to be a little builder like his daddy. And he's funny, he's outgoing, he's a ton of fun, and climbing all over the couch here.
When he was born, basically they said, hey, he's got a heart murmur, and we were just advised at that point that the best course of action at that time was just to keep an eye on him. And they said, hey, this is fairly common. The hole that was close to his heart valve, and so they said, hey, if this doesn't heal itself, then he's going to have problems later in life. He may grow out of it, but if he doesn't, then it might require surgery. At some point, we got a phone call, and they said, hey, this is really a good case for surgery, and you probably should get this taken care of.
And so I kind of, at that moment, I was like, well, you can make your recommendations of who we should have the surgery with. No, I'm going to do my research, and we'll go anywhere we have to in the nation. But I did immediately start putting out my feelers, and then it immediately put me in touch with another mother that had actually her child had had surgery with Dr. Frazier. Another mother whose child has had 5 surgeries, and she immediately said, Dr. Frazier is your guy. Another personal colleague, she said, there's this great new doctor that's come to Austin. And then I did do my due diligence and research, and we together talked about the benefits of staying here in Austin with this great doctor. And it all just, the stars lined up. It felt like God put this person right in our path, right at the right time. And that went so well that that's the only person we sat down with.
I'm Charles G. Frazier. I'm the director of the Texas Center for Pediatric and Congenital Heart Disease. I'm the head of cardiothoracic surgery at the University of Texas Dell Medical School, and I'm also the chief of the Division of Pediatric and Congenital Heart Surgery. I've been really blessed in my career to work at great hospitals around the world. What I observed over essentially the entire course of my career, but particularly the last decade, is that care for patients and families can be very disjointed. Anyone that's been a patient in modern healthcare knows that it can be really confusing. Where do I go? Who do I talk to? Is the right hand talking to the left hand? Negotiating the system can be extremely difficult. It's difficult from a medical perspective, financial perspective, logistical perspective, emotional perspective. It is more of a burden than I think most of us want to appreciate.
I mean, I can remember from my childhood, I was in the hospital for a little while, and so I was really nervous for Levi's sake, because for me, it wasn't a fun, pleasant experience. I'm amazed. I mean, it really, in retrospect, it was 10% as difficult as I thought it would be.
Every appointment, every email exchange leading up to it, support and people asking me, do you have all your questions answered? And nurturing support. It really was.
One of the best things of our program is the emphasis on truly making patients and families feel like they're part of our family. We essentially want to care for them, embrace them as part of our team, as part of our family. We're all in this together, the patients, the families, and ourselves, on providing the best care for patients.
I feel like I can see a surgeon walk through the door, an anesthesiologist, an attending, a fellow nurse, and RT, and I have a very personal connection with all of them. We treat each other like close friends. We respect each other. And I think that goes a long way with how we care for patients. I think that families can really pick up on how in tune we are with each other. And I'm hoping that translates into the really meticulous care that we are providing.
People think that we do an operation, everything's successful, and our job is done. That's obviously very important. But what's going to determine how a particular patient and their families are going to do in the long term depends on a lot of things. Social aspects matter, psychological aspects matter, emotional aspects matter. We have created a program that's unique and special in that sense, that we really want to focus not only on the medical aspects. Obviously, we want that to be perfect, but we also embrace the patients and the families so we can really give a holistic care for the patients in the long term.
When you see a world-class facility, and in this case for children, coming to this beautiful city that I know that the rest of the world is now figuring out is such an amazing place, it makes me very, very proud of my city that I was born and raised in.
Some of the ways where I see cardiac care and care in general is really changing is in the field of heart failure and transplant. When I first started out as a fellow and just junior training, we were really learning all the mechanical pumps that we could use to help kids survive while they wait for a new heart. Those pumps keep getting smaller. We now send kids back to kindergarten with their pumps and send them home to their families far away and are able to remotely monitor them through these wonderful advancements in technology.
Some of the easiest examples are in imaging, and we can instantly see ultrasound images of the heart as it's being performed, even if it's in another city. For instance, that could happen across town, or it could happen in Waco, and we can help physicians quickly diagnose and manage patients and ultimately get them here. A more complex example would be just the development and advancement in medical devices. There are now devices that we can deploy through catheters, long plastic tubes inserted in the leg, to close holes in the heart, to replace heart valves, and these are things that used to require open heart surgery just a few years ago. Being under the banner of the medical school is tremendously helpful in terms of engaging resources and also the collaboration with departments of biomedical engineering, all sorts of basic sciences that will allow for the types of research that we hope to start and build here in the medical community in Austin. Until now, that was very challenging to do, but within the UT system, it allows for lots of collaboration, lots of multidisciplinary teams working on a common problem that could ultimately benefit children with heart disease. So the easiest example is our own team that we've built here, which includes surgeons, cardiologists, anesthesiologists, ICU doctors, and many others, all focused solely on the care of children with heart disease. And we hope to expand that to include discussions that would also involve basic scientists, engineers, people on the undergraduate campus, and I think the opportunities are limitless.
I think that on the whole, just to kind of summarize, you know, I think Dell Children's Hospital is a world-class hospital. You know, it's just such an amazing blessing to all of us. You know, as parents, to have a resource like that for our children here in the greater Austin area.